A very good morning to the distinguished judges, respected teachers, ladies and gentlemen. I'm here to enlighten you on the reality of the coronavirus pandemic. As everyone knows, the symptoms of COVID-19 are fever, cough, fatigue, chills, shortness of breath, loss of smell and taste, headaches, body aches, sore throat, nausea, and diarrhea. The coronavirus leads to pneumonia, respiratory failure, septic shock, and death. These complications are caused by a condition known as cytokine release syndrome. This is when the infection triggers your immune system to flood your bloodstream with inflammatory proteins called cytokine. They kill tissue and damage organs. Most of us imagine COVID-19 patient with an oxygen mask over their mouth, comfortably lying down and reading magazines. They seem to be enjoying themselves on a comfortable air-conditioned hospital bed. The ugly truth is, their lives hang on ventilators. Ventilation for COVID-19 is actually a painful intubation that goes down a patient's throat. The tube is inserted from the mouth up to the trachea and allows him to breathe to the rhythm of the lung machine. The patient cannot talk or eat or do anything naturally. The machines keep him alive. The discomfort he feels from this intubation means medical experts have to administer sedative and painkillers to ensure tube tolerance for as long as the machine is needed. In fact, he is in an artificial coma. After 20 days of this treatment, a young patient loses 40% of muscle mass, gets mouth or vocal cord trauma. He is exposed to pulmonary heart complications. For this very reason, many old and weak people just cannot withstand the treatment and succumb to the disease. As for nutrition, a tube is inserted into his stomach either through the nose or skin for liquid food. A sticky bag is inserted into his anus to collect the diarrhea and a Foley to collect the urine. An IV drip is inserted for fluids and medication. An A-line is inserted to monitor his blood pressure that is completely dependent on finely calculated medical doses. Teams of nurses, CRNAs, and MAs reposition the patient's limbs every 2 hours to prevent bed sores. The patient lies on a mat that circulates ice-cold fluid to help bring down his 104-degree temperature. The latest updates on the 5th of November 2021. It was reported in the New Straits Times newspaper that there were 3,432 Delta variant cases, 226 Beta variant cases, and 14 Alpha variant cases. There were also 13 Delta variant cases, 4 Kappa, and 3 Eta variant cases. My respected audience, never underestimate these deadly enemies. Now, healthcare workers are no longer the frontliners. They are your last line of defense. You, my dear audience, are the frontliners now. The war has shifted to the community, and it is up to you and I to join forces against these unseen enemies. Thank you.